From Singapore to Japan, Thailand to Hong Kong, Asia is fine-tuning strategies for dealing with the COVID-19 Omicron variant as the world waits for more information. It will be several weeks before we know how dangerous the new strain might be. In the meantime, governments are stepping up control measures, hoping they will not be forced to reimpose full lockdowns.
It's a race against the Omicron variant. Japan has reported its first case of the new strain, a day after announcing tougher border curbs. A visitor from Namibia had tested positive upon arrival at the airport. Australia is on alert after an international traveller infected with Omicron spent time in the community in Sydney. Officials are rushing to track the person's close contacts and locations visited. This brings Australia to 6 cases of the new variant. But even as the country ramps up COVID-19 restrictions, Prime Minister Scott Morrison has ruled out another full lockdown.
In Australia, we're moving forward. We're not going back when it comes to this virus. We are going to keep moving forward into Christmas and into 2022, and we're going to open safely and we're going to stay safely open.
Thailand also says Omicron will not stop its reopening plans. Since easing border curbs this month, it has welcomed more than 100,000 international arrivals. The kingdom says it desperately needs to revive its economy, and resealing the border will be the last resort. Hong Kong, too, says there's no need to completely close its borders just yet, even as it confirms a third imported case of the Omicron variant. Instead, the government has expanded a travel ban for non-residents from 13 more countries, including Australia and Canada. At the same time, more help is on the way for Africa to shield it from Omicron. The variant was first reported in South Africa. China has promised to supply 1 billion vaccine doses to the continent, with 600 million doses in direct donation. India has also made similar pledges. Vaccination rates have remained low in African nations, with only 42% of South Africa being vaccinated. The numbers are even lower elsewhere in the region. Vaccine hesitancy and logistical issues are key reasons behind the low uptake.